Oh, Brandy, you accidentally
You're back on mute. Oh, I am so sorry. Okay, can you hear me now?
Yes.
Okay. I know our focus is on how we actually model the downstream survey data concepts using OMOP, but I thought in order to really emphasize or add context to that, I would give you just a brief, broader picture of within all of us, how we develop our surveys, field those, and then how we structure those.
You're back on mute. Okay.
I am, okay, there we go. Sorry about that. I don't know why I'm having trouble. Okay, so just to give you a historical look at all of us, in 2015, that's prior to the actual establishment of the program, NIH put together what they refer to as a protocol working group with representatives from across NIH centers to help draft what they really believed as the prioritized areas of research that self-reported survey modules should support within all of us. And then within those survey modules, they pulled together a selection of suggested items sourced from the literature. So where in other well-established cohorts, observational studies, have we asked questions that would benefit a program like all of us to add to longitudinal data, allow for cross-analysis. So that happened even before we launched the program. In 2016, NIH awarded a preparatory award that was meant to really sort of explore the landscape and figure out what might work well in a program that was meant to be as broad and as large of scale as all of us. So at Vanderbilt, that's locally where Queenie and I are both located, we were given a one-year award to take those initial suggested survey modules, do some qualitative and quantitative testing around those, do some lit reviews, figure out how we could take that really large body of work and condense it down to 3 baseline surveys that we could launch for the program, which we did. In 2017, all of us actually started enrollment, and we kicked that off with 3 baseline surveys, the basics, which is sociodemographic characteristics, lifestyle, which is a person's history of smoking, substance, and alcohol use, and overall health, which is pulling a lot from some of those promise measures around general health, physical health, mental health, as well as a subsection on reproduction health, just for participants who respond female for an item we have about sex at birth. And then in 2020, we launched the very first iteration of the research data set that included survey responses. So we officially launched what we refer to as the Researcher Workbench. This is a cloud-based platform where researchers can go online and use the All of Us data sets. Those data sets are compiled in what we refer to as a curated data repository, and we version those. So 2020, we launched the very first researcher version. Looking at the way that the program develops surveys, so this is just giving you a glimpse at what they consider to be key principles. A survey questionnaire needs to, the items, it needs to be able to advance science. They're meant to complement or augment information from other sources like the electronic health records. So all of us prioritizes collection of information that's either going to be incomplete or may not be well recorded or even captured at all in the EHR or another source. We also try as much as possible to reuse existing measures from other national studies. And then we do still do a bit of qualitative and quantitative piloting prior to their release. So we do a very small series of cognitive interviews and completion time testing so that we get a sense of how well all of those measures, when compiled together into a single survey, might do in terms of participant burden, participant understanding, clarity, sensitivity. And the program guidelines for developing the survey are, step 1 is to define the vision. This happens at the senior leadership level. So the executive and steering committees decide what they're going to prioritize in the program's roadmap for work that year. That then gets fielded over to what we refer to as our PPI committee. This is our self-reported survey committee who decides, let's figure out within that roadmap of prioritized work, what are some survey domains that might make sense. Then for each survey domain, we do a small group that will go and review the literature. It's usually a group that includes expertise within that domain so that they have a really good knowledge beforehand of what the literature says and what might work well and what may not. And they're pulling together items that are from the literature, from scales, subscales, and in rare cases, they may create new ones where there's just not a really good, adequate supply of items out there. We then implement and test the survey, and then once that's all done, we release it to participants for fielding. Those guidelines in action, what that work actually looks like is content development. This is happening within, like I said, a committee structure, a task force structure, prioritizing, figuring out what measures might work well, taking that content in English and either figuring out if there is a existing Spanish translation of that source material, and if not, translating it according to the program's protocol. That very short, brief amount of pilot evaluation where we're actually doing some cognitive interviews, quantitative testing. We're usually doing cognitive interviews with a very small sample size, usually maybe 10 to 20 participants, looking at populations where those source materials may not have been well tested or validated in the literature. And then quantitative testing, that's a larger sample, usually around 300 to 1,000 participants, just to get a sense of how each section of that survey might do in terms of testing timeline or times. Then we'll compile all those findings, submit that to the program for review. Program will decide whether or not to accept that draft survey in its current state or make revisions based on findings from testing. And then we release. Here's a look at the surveys that are currently available to researchers within all of us. Like I said, we have 3 baseline surveys. That's the basics, overall health, and lifestyle. We also have optional follow-up surveys. So once a participant completes those first 3, they're given the chance to complete more. That's healthcare access and utilization. It's really looking at a participant's access to care and some of the barriers that may be associated with lack of care. There's personal health history and family medical history. I will say this is an interesting one of all the surveys we have. This is the one that maps and works most cleanly within OMOP in the current set. And that's really because we're asking participants to self-report a diagnosis or a family history of a diagnosis. So those diagnoses are all based on the SNOMED vocabulary and when it was developed. So there's a standard concept available right away. We also have a social determinants of health survey. This includes, mainly it's compiled of measures that can be scored, so scales from the literature, some really well-established ones, things that have been cited many, many times. We have the perceived stress scale, for example. So this is working as a questionnaire that has sections that researchers can use in many different ways. Then we, for a very limited time, released something called the COVID-19 Participant Experience Survey, which was really a series of surveys. We released an individual standalone survey on a nearly monthly basis for about a year. And then as a companion to that, we have a vaccine minute survey where we ask participants to self-report whether or not they have received a COVID-19 vaccine so that we could augment or supplement that because it was not very well captured in the EHR when that first launched. So what that looks like in terms of a fielding process is step 1 is always requirements gathering. Our actual survey implementation team, so this is moved from development, it's moved now to how do we get this survey coded, structured, ready for fielding to participants. What that group is doing is they are looking to program to provide a final document of the survey content, as well as information about how that survey should function. So branching logic, validation rules, validation perimeters for free text fields. Once we have that in place and we review to make sure all requirements are clear, the team will then take that survey document and transform that into a computable data dictionary or a code book. Each question and answer pair are individually assigned codes, as well as the question name. Once that's complete, we do a small amount of concordance check to make sure that data that is collected from participants in the participant database is transferred to the research database exactly according to those codebook rules. So we expect to test and make sure that the quality is intact in terms of validation settings, branching logic settings, code settings. Once all that work is done, we start fielding the survey to participants. So for many years, we've used REDCap as the source of truth for what our computable codebook, our data dictionary should say. So our tech teams have referenced this, and this is just a screenshot of what that structure looks like. So we actually ingest through an API this structure into our systems to inform us on the rules. We're actually going to transition, I think, over the next year to Qualtrics will be doing the survey fielding for participants moving forward. And they have a system that's very similar to REDCap in the sense that we're able to actually collect and store structured rules for all the surveys. So it'll act the same, it's just a different platform. And then here's a screenshot of what that's going to look like for the participants. So participants complete their surveys online through a dashboard. Within that dashboard, they'll get the invitation. Each survey will start with an introductory screen. And then here's just an example of how those items look. This is pulled from the overall health survey, which does include a few items off of the brief health literacy screen. Now, after fielding, we focus on curation and research where OMOP comes in. So, so if you look back here at our timeline, we're now on step 5, which is curation and research. So we take that computable data dictionary file that I had mentioned, and we actually have that deposited into the OMOP common data model within an all of us unique vocabulary. So I think all of us is unique in the sense that we have our own unique vocabulary. I'm really only familiar with UK Biobank that does this at this point. There could be other groups. I'm just not very familiar with those. So what this means is that we actually work with Odysseus, OMOP's vocabulary management team, to take our data dictionary files, map those coded items, which we will refer to as the source concepts in OMOP. So our initial coded items or codes become the source. Odysseus works with us to take the source and map that to a standard where it can be mapped. And then they take that entire group of source and standard concepts, tie those back to the item text, assign concept IDs, and store those in what we refer to as a PPI vocabulary within the OMOP common data model. We do this ahead of each researcher release. So we release a version curated data repository for researchers to use about once a year. And so ahead of each release, there's a dependency on us making sure that any newly fielded surveys where we have data that's going into that repository, we're working with Odysseus to deposit those codes into the OMOP PPI vocabulary. And then because of, I think because OMOP is still sort of novel in the survey research world, we are making available to researchers not just a link to that Athena repository where they can look at all the codes, but also our data dictionaries so that they can see how they were fielded, so they can see the rules. So once we have our concepts in OMOP, in that vocabulary, the way that works is that vocabulary is stored in the observation table. I will say that's for surveys. So another set of concepts we store within all of us in the unique PPI vocabulary are physical measurement concepts. So we actually do a clinic visit with participants to collect things like height and weight, BMI. Those measures are part of the PPI vocabulary as well, but they surface through the measurement table alongside measurements concepts that are also collected through a source like the EHR. So surveys are PPI vocabulary, they're stored in the observation table, but within all of us, we actually use those demographic characteristics that participants self-report in the basic survey to populate the person table in OMOP. So this diagram is sort of showing you how that actually goes through. So participant provided information or surveys, by default, they populate the demographic sections of the person table. So things like race and ethnicity, sex, and then they're actually stored all together in question answer format in the observation table. Here is just a screenshot of what our vocabulary actually looks like in Athena. So if you're using Athena, you can go online, you can narrow down your search to PPI vocab observation table, and you'll get the full look of all of our concepts, which totals over 5,000. So it's a very large, library at this point. And then taking a step further, so even further downstream, once those are in OMOP, they're in a curated data repository. I just wanted to touch briefly on the type of support we provide to researchers working with those. So all of us has a researcher support model that includes really a low touch perspective on support. So we are doing things like helping researchers gain access to the researcher workbench following our program's access framework and policies. We are doing regularly occurring virtual office hours for researchers who have questions about survey data, other data sources, using the platform, using any of our tools. We also have an online knowledge base called the User Support Hub, where we store articles and documentation about all of our data sources and tools. And then we have a virtual help desk where researchers can ask a question via email to any of our support team. We also do some outreach. So for groups who are just new to the workbench or new to using our data, they want to get their own local departments involved. We are happy to always do webinars with those groups to talk about what we have and triage some questions about whether or not the platform might make sense for them. So in terms of support specifically for surveys, here's an example of one of our pages. This is on our public site, researchallofus.org. From there, you can navigate to what we refer to as the Survey Explorer, where you can see PDFs of the English and survey and Spanish versions of all of our survey documents. So you can see exactly what the participant sees, and you can also explore the sources that inform their design. In our user support hub, we have an entire section on surveys, which I've included some screenshots here. So for each survey we release, we try to do a standalone article that talks about how that survey was designed, considerations around the source material, so whether or not there are items that can be scored, who from the cohort was eligible, and then we also have sections that refer back to the actual data dictionaries, the privacy applications we apply to certain items, and links to Athena. Another thing we do are we provide researchers with example analysis notebooks. So within the platform, we have several workspaces that are specific to surveys. So a researcher can see, how would I do something like query response frequency distributions across the surveys? How would I actually go about scoring an item using AOU compared to the source material? And then because we have for so long used REDCap as our method for developing those computable data dictionaries, we have many artifacts that we just contribute to the larger REDCap consortium. So we store all of our fielded data dictionaries in the REDCap shared library that anybody with the REDCap license can use. For researchers who don't have a REDCap license and they'd really like to use our survey data dictionaries to field locally, we also just provide those through our help desk. So I've included a couple of considerations or pain points that we've experienced as a group when using OMOP. I think one thing we've learned is that maintaining a custom vocabulary within OMOP is very resource intensive. It requires a actual scope of work in a funded contract with Odysseus. And it also is, you have to be mindful of your own curation timeline needs and how those align with OMOP's release schedule. So OMOP now release vocabulary updates twice a year. So it's really important for groups who are depositing vocabularies into the model itself that they align those deposits with those releases. I think one thing that we've learned is if we had to do it over again, I don't think we would have taken this approach of having a study-specific vocabulary. One thing I think that we've even just learned about OMOP is, there are so many libraries of vocabularies out there within the data model that I think Odysseus and OMOP are trying to maybe focus and harness their attention to the vocabularies that make the most sense to update. And so in some ways, we're sort of against that model by introducing this sort of outlier. I think if we had to do it over again, we could have just mapped to standard concepts and followed the actual OMOP ETL or those structured tables without actually depositing a vocabulary itself. The other thing we learned is that because so many of our items are sourced from, their psychometric properties, their scales, their categorical demographics, many of them just don't map to a standard concept or a standard vocabulary. Those that do often map to an observational LOINC concept. I would say that's probably the most common. The exception would be the one I talked about, which was personal and family health history, where those are diagnosed conditions. So they're mapping to SNOMED, and they are able to surface in the conditions table. The other thing is that, harmonization is really important. So even way more upstream, just figuring out how those items are going to be asked or having a list of common data elements across studies, observational studies, is really important. We're seeing researchers who are really interested in using the items that we have in All of Us to co-analyze data that have exact or like items from other observational studies. So seeing, for example, looking at two cohorts and analyzing data side by side, I think making sure that your survey items are asked and are coded in a way that might be similar to those that are already fielded, I think goes a long way to help support researchers. And then I think I had my slides a little mixed up, but I've also included here just a list of resources that you all could check out. And like I said, Nicole, I'll make sure that I include this. I'll send you this copy. And that's all I had. And now I need to figure out how to stop sharing. Okay, there we go.
Thanks, Brandy. That was really helpful. It's interesting as you go through to kind of see like connected this the same way or connected this differently and things like that. Two questions I had for you. So for the concept IDs that Odysseus assigns, are they unique to All of Us? Like, are they specific All of Us concept IDs? Because you've got the unique vocabulary as well.
Yeah, so anything that's stored in Athena, to my understanding, is tied to a unique concept ID. Mm-hmm. So there's the source, and the source code that we use is given a concept ID that's unique, mm-hmm. and then that's mapped to a standard concept where we can, and then that's given that standard concept ID. Okay, so the source are unique, but where we're just mapping to the standards that already exist.
Okay. That's it. And then the other thing I want to make sure.
One quick question.
Sorry, go ahead.
Do you have a sense of the percentage of concepts that map to standards? Because you actually have the data, because we always think it's going to be very little.
It's been a while since I looked at it, so I'd have to rerun it. But I want to say it was something around maybe 30 or so % mapped to something standard when I last checked.
From the survey data. Okay.
Yeah, from the survey.
It's not bad. It's more, yeah. Okay.
Yeah, and one thing I think that's also why we had mentioned something like the Phoenix toolkit to look at some of those items, because I think that there are scales, there are some survey measures that are widely established that are in OMOP. There's just not all that many of them.
Mm-hmm. I was going to, so if I was following the order of steps correctly, mapping actually isn't done until you have data, correct? It's not something you go through as you're working up the survey. It's just done at the end point.
It could be done earlier. Within our program, we're just, by the time we have a final data dictionary that we consider good for deposit, we've fielded it. So we're collecting data, but it could happen as soon as, the only dependency is having a final data dictionary or code book established.
Okay, that makes sense.
So these code books can be found, you have on these resources at the end, right? The code book to see how it's, and that doesn't require any login or anything. That's public. So
It's
following that
public.
link, you'll be able to see your data dictionary and what information you are providing without having to go into the platform, right?
Yeah. Our
Yeah.
our support hub is totally public, and I included a direct link for our codebook page there.
For the code book. Okay, great. Thank you. I have a lot of questions, but I don't know where to start. Nicole or Tom or how you pronounce your name, Queenie? Yeah.
I was
I
kind
asked
of
mine,
curious
so
about,
feel free.
yeah, the if you could kind of say a little more, or maybe I missed it, about like sort of your lessons learned of that you would not go back and try to recreate your own sort of model for, or maybe not model, but like assign the concept IDs to the survey questionnaire. I'm kind of wondering about that, because I mean, like 30% like mapping it's good. It is better than I was thinking too, but like it's still kind of a long way to go. Like so I guess, yeah, what approach
How would you
are
do it differently?
thinking?
Yeah. What would have
Yeah.
done differently? Because you still have 70% that don't map.
If we were going to utilize OMOP, but not to the extent we have, I think that we could have just mapped it. We could have just mapped it and used the actual like OMOP structure, like downloaded the actual, like follow the same table structure for our output, map those ourselves. But what we're doing is we're taking a step further than that. We're actually curating a vocabulary itself within the model, which means that we sign a contract, we pay a fee to Odysseus, the data management services, to actually take and not just map to a standard concept, we deposit everything into the model itself. And I think one of the reasons we did that was because we were sort of thinking, well, you know, we're open source. We want to help the model grow. We want to help support that. And then there could be times where a research group may be able to utilize our own source concepts for their own work. And that's not necessarily true, because they could just map the same way we are. So it really just has created, I think, more work than necessary. We could map without doing all the things we're doing.
So then if you will do that, then about 70% of your fields or wouldn't be mapped to any standard, but you'll still find it helpful to assign a concept ID for those for the management and curation of your own data, even if it's not mapped. Is that because that's what basically Connect is doing, right? So Connect is not depositing all the concept IDs to Odyssey and paying Odyssey to incorporate them, but it's still creating concept IDs so that it's for the basic to annotate the data in a way that maybe is more easier in the future to use. So is that what you would have, you think you would have done, to still assign concept IDs, but not necessarily through Odyssey, and then in the future, the more things, as with this working group that we're doing here with Nicole, we'll be producing more and more standards, and as more and more standards are produced, then each of the cohort can start mapping their concept IDs to those standards, but you don't have to create, you're saving that step of Odyssey adding. Is that what you mean? Or
Yeah, I haven't thought about it a lot. And I think, Nicole, that's where I did send an invitation to a colleague from NPH. That's what they're essentially doing, is they're where things don't map, they're just assigning a OMOP-like concept ID. I think that's one approach. The other approach is just to simply, as you create your data dictionary, you could, I said it was dependent on a final dictionary, but you could just code it according to the standard concepts, and where there are no standard concepts, code it according to the literature. Like if you're using like a common data element, or you're pulling something from another study, like just use a shared code. So I think you could do it either way, but I don't even know if you would need to create your own concept IDs.
Yeah, what do you think, Nicole? Because I thought the idea of creating your own concept IDs is that then it makes it, in a sense, the concept IDs include the metadata about the data, right? That's the whole point.
Yeah. So
That's a
for-
way to have the metadata embedded, in a sense, within the data. So when you send, and it should be easier to create data dictionaries, right? Because you're pulling the information from the concept IDs.
Yeah, so
theory.
for us, yeah, so basically, I think no matter what you do, at some step, there's at least one mapping, right? So like what Brandy just said, you could go through as you're putting together your questionnaire, your dictionary, seeing what matches an OMOP and what you can get from another common data element or a publication or whatever. But you're always going to have to map at least once. And so what happened with Connect is, at the time we were developing all of this, I was my team, and there was no bandwidth to map to anything. So the idea with the concept IDs was to help us with managing the data dictionary and the data elements. And then it really helps us internally. And then also, by virtue of the way the dictionary is structured, it should also make it easier to map in the future. So one of the things we did, and I don't know if this was intentional in all of us, but it's one of the things I got from the early days of being able to pull from the API that your sort of data hub is at, where you can kind of get the snapshot looks at everything, is having concept IDs at different levels in the hierarchy. So there's one that describes something at the it's a questionnaire. It's this questionnaire. It's a question from this questionnaire. It's the answer from this questionnaire. So you basically have 4 concept IDs associated with a question that tell you not just what the question is, but where the question exists in the scheme of things. And I found that hierarchical organization really helpful. And so to some extent, that's how the Connect dictionary is modeled. And so by having that hierarchical nature, I think it's like, okay, so for example, your personal medical history section is very similar to what we have in our background and overall health section. So basically, based on that level of questionnaire you have and what we have at that level, that I say, okay, these are questions that I think we can line with that. And so it just basically helps kind of funnel or filter down where to start mapping. And that's one of the reasons I liked it. And then internally, concept IDs provide a lot of help with just managing the data. So we can make updates to the name of the variable or a description of the variable, and nothing has to change in the code. The concept ID stays the same in the code. And so that's extremely helpful.
Yeah, and I think what you're talking about, Nicole, is also, I'll just put a link here for an example of these. That's also pretty dependent on this existing as its own vocabulary, because we're following a structure, a hierarchy structure that OMOP is creating. So there's a record, which I just put in there and you all can see. So it's that part of it is tied to the fact that this lives as a vocabulary, the fact that they're able to add structure in that way. I think the downside are where I don't think that OMOP having a vocabulary of survey data elements can live on its own is, it's not able to surface those rules. It's not able to tell you about branching logic. It's not able to tell you about field validation, the things that a researcher needs. So one thing that we've learned, which I guess is another lessons learned or pain point, is that in this state, you have to augment the information you're getting from Athena or OMOP with that code book, the way that you actually fielded it, because there's nowhere to surface that level of metadata in the record itself at this time.
That's a really, really good point. I didn't think about that because, like I said, we're still totally working from our data dictionary. So it's all in there. But that's a really good point. I hadn't thought about that.
Sorry, could you repeat it? I missed part of the point. So you say that the amount of information that is captured by the concept ID has to follow whatever format Odyssey has. And that's, so you can take me from there. So that has some limitations on the, because it doesn't include, is that what you meant? So
Yeah, the benefit of the OMOP vocabulary management workflow is that you are producing a hierarchy, like Nicole had said. So you can actually tie together this module ties to this grouping of items. This grouping includes these 5 items which tie to these responses. So that is really nice. And I think our own team, our own data science team loves that element of it because you could just query the data and pull a grouping of items. The downside or the limitation of not just vocabulary, but OMOP in general is that you can't surface the fielding rules that are likely to be of major importance for the researcher. Things like branching logic, field validation, even the actual like the ordering of the items. Those are things that you don't surface through a data model.
Maybe I'm not understanding the vocabulary. So what do you mean surface?
Like if you have an item that is a follow-up item and it's dependent on a response of A or B to the previous, you would want to know what participants were eligible to see that item. And that's not there. Or if your research is really dependent on the ordering of items, so that, looking at like the burden of who skipped, missing this. So you want to know, did this item fall later, early?
That level of checking. But I thought you do that separately. That's not necessarily, it would be nice if it's embedded, but that would be very specific to a survey, right? Well, maybe not. There are some of these rules apply to lots of different data. Like if you have a parity and you have age at first birth, there are logical checks there. So is that what you mean? Like they are not embedded. So, but you could that's having concept IDs allows you to then write outside of MOP those checks, even if it's not embedded within the. Is that, it doesn't make it easier.
That's all I'm saying is that you would, at least we've seen that you need to supplement that with at least some other
you need to do it separately. But it doesn't make it easier than if the traditional way we've done it with our concept IDs to do. It should be more reusable, right? Because if you're doing that with certain concept IDs and then I map to those concept IDs, then I can reuse that logic. Okay.
So there's probably 2 levels of reusability. This is a question in isolation in OMOP, and this is what it maps to. And then there's the supplemental document that says, this is where this question was in this survey and how it was used and how you get to it and what comes after it and that sort of information.
So what do you do with derived variables? Do you do any, because you have all the variables that come straight from the questions, right? From the surveys, and then if I understood what you were doing in the process of basically before you start collecting the data, you already map the data to a data dictionary, and you select the way you determine how the data is going to be sort of formatted as it's collected. But this is kind of what we will call the raw data. And then usually to analyze data, people just create derived variables using a combination of all of those. So is that every investigator that does that, or is that any reusability of that? And do you think the way that you structure the data makes that easier for investigators to share their kind of derived, and then the derived variables are not mapped to the OMOP necessarily? So what do you think of
So the way that we curate survey data is we do very minimal cleaning or transformation outside of mopping it, applying our privacy rules. And then some of the things we do with those example analysis notebooks, like I had mentioned, we're showing researchers examples of how you could derive items from there. I will say I definitely see researchers who recode it because it's their own thing. They want to collapse down. Our data is in long format. They want wide. They want a very particular look of something. So they're going to recode it and collapse it one way. Another researcher is going to code it and collapse it. So we've sort of taken the approach of keep it as do as minimal an application as possible to transform it.
Releasing
so that
basically raw data with some light cleaning.
Light cleaning, because it's research agnostic, all of us as a program. So we want to be able to support lots of different use cases. There are people who want to work with it and look at, certain items from the survey combined with EHR. There are people who just want to work with the surveys. And then Queenie, I don't know if you have any thoughts on that, but Queenie is also my colleague from all of us. And I know you've talked to some researchers about it. We've considered some ways that we can add some derived variables, but we don't do much beyond.
At least the code so people can reuse the code to derive some variables, because sometimes it's a lot of things that people do all the time and you have to figure it out. So it would be nice to have a repository of code if people are willing to share. But it could be pretty difficult sometimes to use code from others.
I think that's what we've sort of done. So featured workspaces gives you examples of queries and codes. We have a repository of what we called code snippets. So if there's certain functions you want to run in your research, you can run those. And then the other thing we're releasing this year is a feature that we call community workspaces, where if a research team has done an analysis and they want to share it, they can make their analysis notebooks public to any registered researchers.
That would be living on. Go ahead, Matthew. I'm sorry.
I'd say that hopefully that will be required by when people publish their papers.
That's what I was going to say. I was going to
ideally they should publish also the code so somebody can completely reproduce the analysis, but not everybody wants to do that.
Yeah, that's one of the things we're requiring in our user agreements for Connect is that they share back the code for any variables they create that are published. And I was going to ask if all of us had something like that. Were there any requirements of the researchers? So it sounds like what you're setting up is more optional, but it's not necessarily required that they share back. Is that correct? Yeah.
And share back, you mean publicly? Sorry, Tom, I keep.
Well, no, because that's exactly my question was like, is it publicly or do you need like an all of us account to log into the research platform to get access to it?
We need an all of us account to actually see the notebooks itself, because within the notebooks, it won't just be the code, it'll actually be the output. And the output may contain numbers or figures that are, that require registration or compliance with our policies. I have also seen researchers, so this isn't something that we necessarily support, it's just more crowdsourcing what we see, but we see researchers who create custom tools or packages and just post that code repository to GitHub, something like that. That's totally accessible.
Yeah. So Nicole, is the rule in Connect that people that use data in Connect, they have to deposit once they publish, they need to deposit their code public, not just available to you, but
right. Yeah.
public.
So it's going
so they can reproduce the
analysis. Share back the code. Yeah. To a GitHub
share back is different than make it public. So you mean make it public?
Oh yeah, it would be
okay.
Yeah.
Because I think UK Biobank asked that the code is, I don't know whether they implement it or not, but in theory you are supposed to send the code back to them, but it's different to actually make it public with the publication. So,
and I think, this is one of the things we're going to be spending a lot of our retreat this year talking about is how we're sharing out and rules around it and whatnot. But right now we're talking about using POSIT for the data sharing, and then the notebooks you can use in that are the Quarto. And so I don't know. I mean, we have to look at if there's similar issues with it also shows your outputs. We definitely just want to be sharing the code only. So, or, the other thing is too, is you can use our studio with Posit. And so that might be the route we go. And then of course you can also use Python and JavaScript with it. So yeah, so we'll have to think about like the safest way to share the code. And of course, everybody worries. We're trying to avoid service accounts, so we don't have to worry about service keys and things like that. So we'll have to be, there's going to be a lot of thought put into how most securely to share this so that nobody's can get into the system without permission or there's no accidental, data included in the code. But the idea is yeah, because all the repositories we have for Connect are public.
Mm-hmm. Yeah.
So that would be true of what the researchers share as well.
So since we don't have a lot of time, Brandy, I wanted to ask you, based on your experience, what do you think this common data model survey or MOB working group should do? Because we are more advanced than I think any of us in doing that. What do you think would be useful for the MOB working group to do?
What we have in terms of objectives of helping develop some resources to point people to mapping or just better utilizing OMOP, I think that's great. I think if we were looking to explore like a vocabulary or something, I feel like it's really important to figure out a list of common data elements across studies, like prioritize that list. Yeah, because it's only as useful as the number of studies that are actually asking the question in that way or using that item.
Yeah.
So I feel like maybe the first part of just providing some resources or instruction for how to actually go about mapping and some of the benefits of that.
Specifically survey data, right? Because we're talking about survey data. But that will be, from your experience, is 30%, and for Connect's probably even less because it's a lot more extensive. The questions are a lot more extensive. So the more extensive probably and detailed, probably the least mapping, I would guess. But I think maybe from what you're saying, the use case that I think we had discussed or proposed to start with within the cohort consortium with a common data dictionary, which has gone exactly through what you're saying, has already identified the common elements across multiple prospective cohorts. That seems like what you're saying, that could be useful to create OMOP standards on these data dictionaries, maybe starting with the BPC3 or some of, right? Or is that what was that?
BCRPP.
Sorry, BCRPP. BCRPP. Yeah, the breast cancer. Yeah, so that seems to map okay. Just wanted to circle back to see from your experience.
I think the other thing though is that, we're a lot, what doesn't map is because the purpose of our studies are really to augment data from another source like the EHR that is mapped. So, depending on the observational study, if they're asking questions that they don't have another source to rely on, it may be more about a clinical finding or something that would actually map there. So that's the other thing. I mean, I think the benefit is that it gives you two things to do. That's how I've come to see it. The benefits of using something like OMOP or mapping to a standard concept makes it easier for a researcher to co-analyze that data with data from another study, like the exact same question. The other benefit is that it allows a researcher to utilize multiple sources of information for the same data element. So a diagnosed condition, they can pull that from a survey as well as the EHR. They're looking at a standard concept.
Mm-hmm. Yeah. And then those make sense to take them through Odyssey and make them official because we know many cohorts can map to it. And we actually done the mapping in the cohort consortium many times. So I guess if we will put them there, then each study, so that in a sense, you make them reusable. So like the next cohort consortium project doesn't have to create a new data dictionary. They're just using the standards that have been already deposited in a MOB. So I think that's the advantage of, rather than doing what we are doing right now, which we keep in spreadsheets. And just
Or
going
just
through the rationale
pull
to be
from the
sure.
source.
Yeah,
Yeah,
you'll
just
pull
pull
from the
from
source.
SNOMED. Use the existing SNOMED to map backwards, and then you don't even need to put your conditions in there because they're probably already there.
Yeah, but the ones that don't, the survey, the many that don't map that to SNOMED or to others, because I think that's the whole point, right, of this working group, Nicole, is to create additional standards.
Yeah, I mean, I think at some point, there will be that, like an increase in vocabulary, or maybe working with a group to integrate, things that all of us has already done that aren't in the regular vocabulary. So at some point, I think it will be necessary so that 70% everybody can map to. But I think, this first year is really about looking what already's out there. So I think Brandy brought up a lot of good resources, like if it's not in OMOP, is there a common data element for it? Things like that. And then looking, with the part of the landscape survey, like part of what we're doing with these presentations is landscape survey, because we're looking at what other groups have done and use cases and things. But part of the landscape is going to be literally a survey that we share with community. And I think what we're going to find is there are a lot of one-off or maybe two-off attempts at using survey data with OMOP, and we'll see what's already out there. What I'm hoping is that we can pull together some of those tools, or, piece together some things that have already been done, and then start building out what's needed to a larger scale for the surveys. Because I know there's been work out there. It's just trying to get it all together, figure out what's reusable and what we need to build onto. And I know we're at time, so just two things, housekeeping things. One, I realized on the invite, the reminder had been turned off. So that might have been part of why we lost some people. So I sent an updated invite with a 15-minute reminder set into it, because I know if mine doesn't bing and I get busy, I forget about things. And then the other thing I wanted to mention is we are, and by we, I mean me, I'm going to be presenting our OKRs and our mission statement to the larger CDM working group next Tuesday. So if you're not already a member of that, I'll just forward everybody the invite, just whoever wants to come can go to it. So we'll be presenting that there. And one of the other groups I've talked about working on the survey before is going to be presenting what's the word I'm looking for? Basically a concept ID or level of organization they're adding. There's a missing field for, I think, some of the source mapping, and they're going to be presenting on that, promoting that during that call as well. So they're one of the groups I've kind of been a little bit in a contact with since this started. So it would probably be, if you've got the time, because I know we all have tons of meetings, but if you've got the time, that might be a good meeting to attend.
This is the one next Tuesday, Nicole?
Yeah. I believe it's May 7th is the date. I'll pull it up on my calendar. Yeah, May 7th at 10 a.m.
I'm sorry, did you send out the?
No, I haven't sent it out yet. I'll
okay.
send it
Okay.
out. Yeah.
Okay, cool. Thanks.
Yeah.
That's great.
All right. Well, thanks very much, Brandy.
Cool.
Appreciate the presentation. Thank you, Queenie and Tom, for joining as well. And I'll see if I can share this out in an email so it's accessible to everybody. All right. Thanks, everyone. Have a great rest of your week.
Thank you.
Bye.
Bye.